Welcome to the ARCpoint Labs of Monroe-Wadesboro YouTube channel. Today we're diving deep into a critical issue impacting communities nationwide, the fentanyl crisis. We're tackling a question that weighs heavily on many minds. How does fentanyl kill? It's a question that demands attention, especially as fentanyl continues to devastate lives at an alarming rate. This synthetic opioid, up to 100 times more potent than morphine and 50 times stronger than heroin, is often laced into other drugs, making it a hidden danger for unsuspecting individuals. Unlike prescription opioids, illicit fentanyl is manufactured in clandestine labs, often with inconsistent potency, making it even more dangerous. A tiny amount, equivalent to a few grains of salt, can be lethal. Join us as we explore the devastating impact of fentanyl and the resources available to combat this growing epidemic. Fentanyl's lethality lies in its ability to hijack the body's respiratory system. It does this by binding to opioid receptors, primarily in the brain and spinal cord, which normally regulate pain and breathing. However, fentanyl's powerful synthetic structure binds to these receptors with a vengeance, overwhelming the system. This overstimulation leads to a cascade of dangerous effects. The most critical of these is respiratory depression, where breathing slows and eventually stops. As fentanyl floods the brain, it disrupts the delicate balance of oxygen and carbon dioxide in the bloodstream. The body, starved for oxygen, begins to shut down. Organs like the heart and brain, highly dependent on a constant oxygen supply, begin to fail. Fentanyl can cause an overdose within minutes, leaving little time for intervention. The opioid epidemic, fueled by fentanyl, has cast a dark shadow across North Carolina. Our state, like many others, is grappling with the devastating consequences of this crisis. According to the North Carolina Department of Health and Human Services, more than 3,000 North Carolinians lost their lives to opioid overdoses in 2021 alone. These numbers represent not just statistics, but fathers, mothers, sons, daughters, friends, and neighbors lost to a preventable epidemic. The economic toll of the opioid epidemic is also staggering. Addressing this crisis requires a multifaceted approach, focusing on prevention, treatment, and support for those affected. We must work together to educate our communities about the dangers of fentanyl, promote access to life-saving naloxone, and expand treatment options for those struggling with opioid use disorder. The time for complacency is over. We must act now to stem the tide of this deadly epidemic. While the immediate danger of fentanyl lies in its ability to cause respiratory failure, the long-term effects of abuse are equally devastating. Repeated fentanyl use takes a heavy toll on the brain, rewiring its reward pathways and leading to addiction. Over time, fentanyl abuse can damage vital organs, including the heart, lungs, liver, and kidneys. Chronic users may experience cardiovascular complications, respiratory issues, and an increased risk of infectious diseases like HIV and hepatitis C. The psychological impact of fentanyl addiction can be equally profound, with severe mood swings, anxiety, depression, and cognitive impairment. The constant craving for the drug can consume their thoughts, leading to social isolation, job loss, and strained relationships. Breaking free from the grip of this powerful opioid is possible, but it demands a multifaceted approach that addresses both the physical and psychological aspects of addiction. Section 5. Recognizing the signs. Physical indicators of fentanyl use. Identifying fentanyl use can be challenging, as the signs and symptoms can be subtle and often mimic those of other medical conditions. One of the most telltale signs of fentanyl use is constricted pupils, often referred to as pinpoint pupils. Fentanyl's effect on the central nervous system causes the pupils to shrink, even in bright light. Other physical indicators include drowsiness, confusion, slow or shallow breathing, nausea, vomiting, and constipation. Individuals under the influence of fentanyl might appear disoriented, uncoordinated, and have slurred speech. In more severe cases, fentanyl overdose can lead to loss of consciousness, blue or grayish discoloration of the skin, lips, and fingernails, cyanosis, and weak or absent pulse. If you suspect someone is overdosing on fentanyl, call 911 immediately. Section 6. The deceptive nature of fentanyl. A crisis fueled by accessibility. The surge in fentanyl-related overdoses is deeply intertwined with the drug's accessibility and its deceptive nature. Unlike other illicit substances, Fentanyl is rarely sold in its pure form on the streets. Instead, it's often laced into other drugs like heroin, cocaine, methamphetamine, and even counterfeit prescription pills, making it a hidden danger for unsuspecting users. Fentanyl is cheap to produce, potent in small doses, and highly addictive, making it an attractive additive for dealers looking to increase their profit margins. The danger lies in the fact that users often have no idea they are ingesting fentanyl. Raising awareness about the dangers of fentanyl and its presence in other drugs is paramount in combating this crisis. Education and harm reduction strategies are vital in preventing further tragedies. Section 7. The Brain on Fentanyl. Understanding the science of addiction. To truly grasp the depths of the fentanyl crisis, we must delve into the science behind its addictive nature. Fentanyl, like other opioids, exerts its effects by hijacking the brain's reward system, a complex network of nerve cells that regulate feelings of pleasure and motivation. When fentanyl enters the brain, it binds to opioid receptors, triggering a surge of dopamine, a neurotransmitter associated with pleasure and reward. This dopamine rush creates a sense of euphoria and well-being, reinforcing drug-seeking behavior. However, with repeated fentanyl use, the brain adapts to this artificial surge of dopamine. It becomes less sensitive to the drug's effects, requiring higher doses to achieve the same high. This vicious cycle of tolerance, withdrawal, and relapse underscores the powerful hold fentanyl has on the brain, making it challenging to overcome addiction without professional help and support. Section 8. Breaking the chains of addiction treatment and recovery options. Breaking free from the grip of fentanyl addiction is a daunting task, but it's not impossible. Recovery requires addressing both the physical and psychological aspects of addiction. Medication-assisted treatment, or MAT, is a cornerstone of opioid addiction treatment. Medications like methadone, buprenorphine, and naltrexone help manage withdrawal symptoms and reduce cravings. Behavioral therapies, such as CBT and contingency management, address the psychological aspects of addiction. Support groups like Narcotics Anonymous and Smart Recovery offer a supportive environment for individuals in recovery. Section 9. A call to action, supporting those affected by fentanyl addiction. The fentanyl crisis is not just a public health emergency, it's a human crisis that demands our attention, compassion, and action. We must move beyond judgment and stigma and embrace a compassionate approach that recognizes addiction as a disease, not a moral failing. Supporting those affected by fentanyl addiction starts with understanding. Educate yourself about the complexities of addiction, the science behind it, and the challenges individuals face in recovery. Challenge stereotypes and misconceptions that perpetuate stigma and prevent individuals from seeking help. Reach out to those struggling with addiction. Offer a listening ear, a shoulder to cry on, and words of encouragement. Advocate for policies that expand access to treatment, support harm reduction strategies, and address the root causes of addiction. Section 10. ARCpoint Labs, your partner in building a safer workplace. At ARCpoint Labs of Monroe-Wadesboro, we understand the profound impact that drug use, particularly fentanyl, can have on workplaces and communities. We are committed to partnering with employers in the Monroe-Wadesboro area to create safer, healthier, and more productive work environments. We offer a comprehensive range of drug testing services designed to meet the specific needs of your business. Our state-of-the-art laboratory and experienced technicians ensure accurate, reliable, and confidential results, providing you with the information you need to make informed decisions. Our services include pre-employment drug testing, random drug testing, post-accident drug testing, and reasonable suspicion drug testing. A drug-free workplace is a safer, more productive, and more profitable workplace. Section 11. Hope on the Horizon Resources and Support for Addiction Recovery. Despite the devastating impact of the fentanyl crisis, there is hope. Numerous resources and support systems are available for individuals struggling with addiction. SAMHSA offers a national helpline, 1-800-662-HELP, for confidential referrals. NIDA provides information on fentanyl, its effects, and treatment options. Local organizations offer harm reduction services and support groups. Remember, you are not alone in this journey. Reach out for help and embrace the hope that recovery offers. If you or someone you know is struggling, please reach out for help.